So we're here with Brad and Dr. Payton, and it's our open house. So we've had some patients come by today, and it's just fun to kind of catch up and visit with everybody. And I've known Brad, actually. Brad, we've known each other for about 10 years. Yeah. Brad's what I would call a frequent flyer. In other words, I've seen him in therapy multiple times.
Unfortunately, that's true.
First at another place that I worked, and now here. And so this time we're working with Brad on a foot and ankle problem. He's actually had an injury that goes back a while, at least one surgery, maybe multiple surgeries. Yeah, it's been a little while since I visited with you about it specifically, but so we started out mainly just rehab with Brad, and then that changed into him seeing Dr. Payton after we had been doing some therapy for a while. So am I remembering it?
Yes, that is correct.
Yeah, and it was actually, I was going to say, it's actually Joe that referred him on to me, and just had been having a lot of problems with an ankle that wasn't allowing him to get back to his extreme sports. I mean, he's a big wakeboarder and likes to do a lot of different activities, and it was just getting in the way. And we looked at a whole host of things, and actually you had already previously received a lot of treatment on the ankle in terms of injections and medications, and it came down to whether you're going to have surgery or not. And we decided to continue to just pursue the non-operative treatment, rehabbed it with Joe here at the therapy at Ortho Oklahoma, and I think at this point gotten you back to doing most of what you like to be doing, which was wakeboarding and getting out there on the lake. And I think we've accomplished most of that through a team approach, and I think everyone's been satisfied so far. So it's been great.
So it's July, it's 100 degrees out. Have you been wakeboarding?
I have been wakeboarding, and I raced my first motocross race this past weekend.
Really?
Since my injury in November. So
And?
It went well.
Good.
And that was what stirred the pot initially.
Correct.
You went over the bars, over the pegs.
Yeah, something like that.
Well, good.
Yeah, so, like Joe said, I've known him for quite a while. He's helped me over the past, I guess it's been 11 years actually now I think about it. So unfortunately I keep getting hurt and keep seeing him and seeing him at two different places now, and came to see him. I was going to a doctor in Oklahoma City, and he actually referred me to a different physical therapist here in Stillwater, but I called Joe and came and saw Joe, and he helped me with this. And then he recommended Dr. Payton, which, he was gracious enough to work me into his schedule, and came and saw him. And I just liked the way he, how friendly he is, how caring, how concerned he was, and, how it made me feel that I was important to him. So that was good. And so I started to come see him, and, we went over whether we should operate on my ankle and we should take my plate and screws out or keep it in. And, as with anything, if you don't have to operate, you don't want to. So he encouraged me to keep doing the physical therapy, and we did that for quite a while. And, it's been, I probably haven't seen you in 3 or 4 months now.
It was right before you went to Mexico.
Yeah, so that was May.
That was May, so a couple of months now.
Been going on almost 3 months.
Yeah.
So, and it's doing really good. So I guess I should knock on some wood somewhere. But I don't know. Ortho Oklahoma is great because they really care about you, and they make you feel like you're part of their extended family, and they do whatever they can to get you better as quickly as they can.